FP is plain film, C. So this thing is plain film.
Can you go back?
Yeah.
No, we're gonna go back when I'm,
Just 1 second, just so we can look at it one more time. Okay.
Okay, thanks. And it's reasonable.
there.
We were trying to put it all
Alright,
together.
I should have uploaded it, but I'll upload it, I'll do something with it. Okay, I can't leave because I've got. Okay, so the format was on, ASCII, you're only gonna get 4 choices like this, not 2. Okay, so this is abnormal because your baseline is what?
More than 3.5.
3.5, okay, so dilation, but you still have to deal with this. We said if you wanted to find out whether it was in bone or in the abdomen, you can do some more x-rays. Which ones?
RAO and LAO.
Obliques?
Yep.
Okay, if it moves, it's in the abdomen.
Yep.
Okay, depending on which side, if it stays constant, it's renal-based, nephrolithiasis. Okay, and then we said national boards might be give you 2 parts.
In
The
program.
aneurysm is gonna be between this and this.
Okay.
Okay, all right. So we said bone island is 1, osteopoikilosis is multiple, but the
Yep.
key to it is periarticular. It's not osteoblastic mets because there's a pattern to this. This is periarticular. Osteoblastic mets is random. Okay, these are probably negative, not hot on bone scan, whereas osteoblastic mets should be. Okay. All right, plain film, that's why I chose it. With plain film, not much to see, but decreased signal intensity on the T1 weighted image, increased signal intensity, or at least here around the disc space. The disc space is shot. Okay, increased bone marrow edema, prior laminectomy, clinical features and radiographic features are plain film, MRI. You want to make sure you rule out spondylitis. Okay, we'll do one more, or we'll do as many as I'm getting before 1:45 the hour. Okay. Doesn't show well, but there's an offset. Okay, there's a big offset, L5S1, doesn't matter. What would you do? You need to make sure if you have an antral you rule out this. How do you rule out this? AP lumbosacral spot view, okay? is your first choice or obliques. But an MRI, there's nothing to be gained by doing a bone scan. You already know there's abnormality. You want a bone scan because that'll tell you whether there's bone marrow edema in the pars region or in the pedicle. In other words, they can help you stage it. I'm not establishing, or I'm not gonna put a documentation here on whether there's a pars defect if I can't see it clearly. First intermediate step is what do I need to do in my office to see it clearly? That's either oblique views or the spot view. The MRI adds much more information to it. Bone marrow edema, is the disc narrowed or is there disc herniation? All right, not a whole lot to be seen on this, but BRCA positive, okay? So I can hallucinate 1, 2, 3, 4, 5 little spots, doesn't matter. This is bigger, okay? There's bone marrow edema. The size already in combination with this, in combination with BRCA, this is aggressive. Okay? And then just some choices. It's aggressive. Lytic Mets, multiple myeloma, no, it's unilateral in presentation only. That's what you were given, okay? Chondrosarcoma, there's no matrix calcification, it's multiple lesions.
So you would have chosen lytic mets for that?
Yep. And why? Because lytic Mets and BRCA
Radiodense.
positive go together. Okay. Now, this is still fluid levels. Fluid levels in the cyst worlds means what? ABC, okay? This is unusual in this area of the clavicle. So for board preparations, I'll make sure ABC, number 1 spot is around the knee somewhere, distal femur, okay? So you want to know at least the most common site. This is not a common site for aneurysm bone system, but cyst, the fluid levels clinches it for being ABC. Left-handed golfer. Plain film, very little to see until there's subchondral collapse. So the rotten part of the apple, the brown part of the apple that's rotten will be radiolucent, or this femoral head will collapse. It's so much easier to see on the coronal MRI. This is normal sphericity. This is different. There is a big femoral head, a big portion of the mushroom, all right? And it's a bad image. The projector light doesn't help because it makes everything too bright. But look, there's bone marrow edema in this supraacetabular region compared to the opposite side. And I don't know what this is, but this is misshapen, okay? So the takeaway here is very little to see in the early stages of osteonecrosis. 4 to 6 weeks later in the history of trauma, or this scenario, I want a MRI. MRI is a lot more specific for osteonecrosis, okay? In osteonecrosis, on MRI, something called a donut lesion. Okay, this is the rotten part of the apple. Okay, and then I have bone marrow edema all around it. Okay, so I have decreased signal intensity here, increased signal intensity around it. That edge between rotten and normal creates a ring, right? And that's called the donut lesion of osteonecrosis. Rotten on the inside, reactive bone around the outside. Now, don't think that that's the only donut lesion you can have. Anytime you have that phenomenon, they call it the donut lesion. It's just a description of. Oh, that's terrible. Can you see it? Okay.
There we go.
All right. So this is the rotten part of the apple. Anything around it that's trying to contain it, just like an infection. Okay. Increased bone marrow edema. This is the rotten part. And that, for someone to look at it, reminding them of the Krispy Kreme donut, and that's why it's called a donut lesion of osteonecrosis. Okay, I think we changed this a little bit, but the idea is, okay, there's density where there shouldn't be density. You don't know whether this is truly attached. Get the cross-sectional imaging. It's either a soft tissue tumor, could be a bony tumor that is extending from this cortex into it, or is it just myositis ossificans, heterotophic bony ossification? That should have a history of trauma. The football helmet into the quad, that makes sense. Then that radiographic picture fits. No history of trauma, rule out something aggressive, either bone related or within the soft tissues. Okay? Oops. This is supposed to be 19, okay? Growth plates, density, but it's both in the, overlying the cortex and the soft tissue, but it's dense. It's either, it can't be Ewing's, it's radiodense, so it's osteosarcoma until proven otherwise. I know you didn't have this. Okay. So, why are these vertebral bodies fused? Why is there spina bifida here? Lung, normal rib interspace, decreased rib interspace, pedicle, pedicle, pedicle. There's another added density here. So, spina bifida, this vertical density is called an omovertebral bone, a bone between the vertebral body and the scapula. Spina bifida plus block vertebral bodies. That speaks to, you need to know enchondromatosis or multiple enchondromas. You know what this is, you know what this is. Now I'm showing you a case of this. And that takes care of a lot of congenital malformations that we're going to see. Okay. Slam dunk, this is what? Okay, level. Okay, classic signal intensity, okay, data sets, and we add information here about the spoke wheel type in the skull. Okay. Depending on how this gets set up, this could be chondroblastoma, all right? They keep emphasizing epiphysis. It's rare, 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 rare. This could be cat scratch fever, all right? This is, you need to know that this is a sequestrum. Cloaca is the thing that communicates externally. This is all bone marrow edema. First thing to rule out with this, hot, red, knee, osteomyelitis. Okay, cat scratch fever is an entity in the literature.
Yes, sir. Oh, yeah.
Can you please go back to slide 5? What did you have as the diagnosis?
This,
Yeah, is the
Periarticular
other answer
lesions.
is just periarticular,
yeah.
and then
Osteopoikilosis.
got it. And you just went really fast. You couldn't even.
Okay.
And then the last one was chondro.
Because it's not random,
No,
it's
no.
distinct.
Stop it.
Yeah.
It's, okay.
If it's just the epiphysis without the cardinal sign, without the clinical, it's chondroblastoma. But it's got, it's not,
Yeah, it's all.
it's not in the epiphysis, it's in the,
Oh.
it's in the epiphysis, okay, but it's got bone marrow edema.
Right.
Chondroblastoma wouldn't have that much bone marrow edema, okay, but with the cardinal signs is osteomyelitis. No cardinal signs, and then it becomes possible chondroblastoma.
Cat
What I'm
scratch.
telling you is chondroblastoma is a tumor, is rare. It's more likely to have cats scratching, dogs scratching. Are cats' claws sharper? Must be, because they can dig in.
Oh, yeah. It's like cat scratch fever.
They get under the skin.
I don't even know how I got.
And dogs don't try to hurt you, cats try to hurt you.
Cellulite is, you know what I'm saying?
When you get a dog scratch, they're not trying.